A lot of information in an hour and 20-some minutes. Thank you all, the presenters. Questions? Do we have some questions this evening? I'll try to repeat them if I can hear them so that everyone will know the question before we address them. Yes?
Maybe Director Posey. I know you said our drug addiction or our drug problem is not as bad as some areas, but do we have people dying every day on opioids in the 9th District? Or not in White County, but maybe the 9th District? And if not, are the doctors just not giving it out as much up here, or what?
Well, it's not only the pharmaceutical aspect. Most of the people that we're seeing are ODing is not necessarily directly linked to a pharmaceutical product. It's more, we've seen a shift in the last few years. Heroin is actually cheaper than the pharmaceutical product right now. So the abusers are moving more towards heroin because, one, it's easier to get, and two, it's cheaper. And that's why you're seeing the increase in heroin. And yes, you are having overdoses every day, but no, people are not dying because all of your first responders are equipped with Narcan, and most of them are being saved.
Also, June, we don't always know everybody that ODs on it. If EMS or an ambulance goes out and picks somebody up and carries them to the hospital, and they diagnose them at the hospital as an overdose, we don't know that.
It's not coded.
We can't get that information because I think HIPAA. So, we fight that side of it also.
Okay. Another question. Yes, sir. In the back.
Question, comment. Sorry about my voice. I've been a little sick, and fortunately I have insurance and went to my healthcare provider, but I'm also a nurse at a hospital locally, and we see people all the time who have chronic problems that end up as acute problems and then crises and emergencies, and we end up fixing them in the most expensive way possible. They go to the ER, they go to the ICU, they come out to the floor, we send them home, they've got a bill for $100,000, which is not unusual, that they can't pay, whereas if they went to a primary care physician and then got treated there, it would have been a number of hundreds or a number of thousands of dollars, but it wouldn't have been $250,000.
Right. And
But
one of the
paying it because we're going to pick up the tab, and as a taxpayer, I would like to pick up the tab as cheaply as possible.
right, the hospitals cannot turn down emergency patients. They can limit them to only life-saving treatment, but they have to give that by law. And so if it's cheaper for them to see their personal care physician or a nurse practitioner, someone 6 times during the year than that one visit to the ER. But our system is set up so that those people that are abusing the ER don't have any choices a lot of times.
And the other downside of that is when they're filling up the ER with chronic problems, if you have a heart attack, or God forbid one of these officers has an accident out on the road, then that ER is that much slower to help somebody that really is in a crisis.
Right. Other questions? I saw a hand over here.
I just had a point.
Russ?
I think last questioner was talking about, or what you just talked about is the Emergency Medical Treatment and Labor Act, or EMTALA. It was a law passed during President Reagan's tenure in 1986. Requires hospitals with emergency rooms to take any and all comers regardless of their ability to pay. It remains a source of controversy because it was unfunded.
Right. Now, some hospitals, like Grady, gets a stipend from the county and the city to help run their emergency services. But one of the problems in the rural areas is the counties may not be providing that subsidy to the local hospital. And if they continue to see people in the ER and start losing money, guess what they do? They close down. And so your hospital is now not 3 hospitals in the Northeast Georgia area, there's 2. Or in some places in South Georgia, there's only 1. And it's not right next door, it's 2 or 3 counties over. Yes, ma'am.
You forgot the pledge.
Oh, that's true. We didn't do the pledge.
We forgot the pledge.
Oh, my goodness.
Thank you.
We'll do it at the end.
We'll do it at the end instead of at the beginning. There you go. She was gonna get ready to do that part. Other questions? Yes, Philip.
Sheriff Walden, do our local officers carry overdose, or is there an overdose kit that they are issued, or is that an EMT situation where they're called in?
No, all the officers in the county carry, I think Narcan, I believe the pronunciation of it,
Okay.
as well as drug task force. We got a grant to start with. That stuff's about, what, $35–40 every time you use it. You just gotta replace it. It costs somewhere around $35 to $40.
Do they use the nasal spray kind?
It's nasal, yes.
Is it effective?
It's effective, yes.
Good.
Richard, we have a question over
Yes.
Just a quick comment on that. Because of legislation passed in the last year at the state level, you all can actually get Narcan. And so if you have somebody who in your family or close to you in your household or a neighbor who you know is using substances, it's a good preventive measure to just like have that from the pharmacy in your cabinet, just in case, because it takes EMTs or the sheriffs a minute to get there sometimes, and so if you know and then you can't get that person to go to treatment or something, that's a good kind of backup plan. Obviously, it's not an ideal situation if you're having to do that, but it is an option if you know people in that situation.
Do you have to get a prescription?
No, it's not. It's over the counter. You just need to go to see the pharmacist and ask for it.
Richard, can I make a comment?
Yes.
I'll pick on you. Years back in your teens, people had designated drivers. Everybody shake their heads. Now, these clowns have got designated Narcan holders. He drives them around in case one of them ODs, he can bring him back to life when they're trying out their new drug. Am I not right?
Well, that's.
There's always a plus and a
I
minus,
mean,
isn't there?
I know a life is worth everything, but my goodness, it's crazy. I mean, how can we get them off of it? I mean, oh Lord, that just drives me crazy. I'm gonna have to think about that. Oh.
Yeah.
Other questions?
Just
Josh?
from, and the issue is that could, some people who might be too scared to take it, if they have that around, that might be more likely to take it. But, on the other hand too, some of these people, there is a path out. And sometimes one of those experiences, if they live through it with a Narcan, it could be their path out. There are people who have lived through that and they've reclaimed their life. So, it is a tough moral. It's not. All this stuff it makes it a very gray area. There's no easy, answer. It's good or bad or whatever. It's a mixture of both. But I think the sheriff brings up a very good point.
Yes.
Are there effective treatment options here?
I'm sorry.
Treatment options
Are
here
there
in White
effective
County?
treatment options here in White County?
For the drug overdose.
Like addiction.
Well, for addiction.
Oh, for addiction, well, they've got the NA and Alcohol Anonymous and those kind of things. There's some of those support groups around. We have a group that comes into the jail and sort of presents that to some of the inmates. We've got the beta here. I think that maybe is the state part of it. But I guess to answer your question, we don't really have a big resource here for it.
Well, we got
So
the Black Bear
Bear?
Lodge.
How about Black
Who
Bear?
can afford it?
Well, that's if you got about $25,000–$30,000 a month, check in up there. But there's not many folks here in White County.
So there are no inpatient treatment facilities here?
Well, they got
Just
some
for the
rehab
Well, there's no
centers,
hospital.
Jail.
Well, but that's
I got
not
the best
treatment.
one in the county. You don't get it. My-
So,
Yes, Laura.
yeah, a couple of comments on that. First of all, for people who are either have Medicaid coverage or are uninsured, every county has a community service board which offers mental health and substance use treatment services. They're community-based, they are not inpatient. I don't know if White County has a methadone maintenance treatment here or facility here, but the most effective thing for substance use, or for addiction in particular, especially from opioids, is what's called methadone treatment. And essentially it's a drug that you take on a regular basis, and it blocks the receptors in your brain from accepting the opioids, so you can't get high from an opioid anymore. There are a number of methadone maintenance treatments across the state, and so we should find out where the closest one
I
is.
believe the closest one that comes to my mind is across the mountains, in like Blairsville,
Okay.
there may be one over there.
Yeah.
There's one in Blairsville, and
And it was on the front page of the Gainesville Times last week. They opened a it's more of a peer support type group for people that are addicted to opioids and other.
Right, out of the Northeast Georgia
Yes,
Hospital,
at the hospital.
but again, that's in Gainesville, but it's closer than
Yeah.
Blairsville.
And we've got some accountability courts here now that are doing for the folks that's got the addiction problems. You know, I guess it's to who's discussing it as to whether we're seeing a great success there. But, we do have those.